Thanks for tuning in to the English video of COVID-19 in 19 minutes, brought by AppilyDay, collaborating with over 30 nonprofit youth initiatives across the country and over 100 high school and college students across the world. My name is Pei, and I'll be your presenter throughout this video. So here are the topics that we're going to cover in this video. We will link the specific time frame for each topic in the description box below. If you'd like to skip from one section to another, feel free to do so. Alright, so what is COVID-19 and why should we care? Corona means crown. This refers to how the virus looks under the microscope, like there's a crown on top of the virus. Coronavirus with a capital C describes the family of coronaviruses. Some of them cause common diseases, from a common cold to respiratory illnesses. Others affect animals, and we suspect that these viruses jump from the animals into the human population. Now we're specifically talking about a new type of coronavirus called novel coronavirus. Here we want to do a differentiation. A novel coronavirus is a virus that hasn't been previously identified, and COVID-19 is a disease caused by this novel coronavirus. In early February, World Health Organization announced COVID-19 as an official name for the disease, first identified in Wuhan, China, where CO stands for corona, VI stands for virus, DE stands for disease, and 19 represents 2019. The theory is that COVID-19 may have jumped from an animal species into the human population and begun spreading, but there's no evidence yet. Now let's briefly go over the current situation. We'll provide some charts, graphics, and stats to showcase the spread of COVID-19 and its effects. The World Health Organization said it considered the Americas to be the new epicenter of the pandemic. The increase in some countries can be attributed to improved testing programs. In others, though, it appears that the virus has only now arrived with wide scope and fatal force. The U.S. has been one of the countries that was hit the hardest by COVID-19. In early April, the death toll in the U.S. has surpassed Italy's, putting America at number 1 worldwide for the number of people killed by the virus. As of the end of June, at least 1,820,200 people across the U.S. have tested positive for the virus, and at least 105,000 patients with the virus has died. In the U.S., the growth rate has stabilized, but experts believe that its cases are still being undercounted and fear that premature reopenings in some states could lead to new outbreaks. Concerts, parades, and baseball games have been called off. Unemployment claims have spiked. Some governors have imposed quarantine requirements on Americans who cross state lines, and even as states reopen, officials have warned that the virus was likely to remain a persistent threat. Since the number of cases are changing every single day, we are providing some reliable resources for you to check out instead of including the temporary stats in this video. You might find the information of cases in your country, in your state, or maybe in your city or county. First off, CDC. It will give you a weekly summary of the stats, mortality reporting, and even some forecasting using mathematical models. Next up, you should always be informed of the information released by your state and territorial health departments. Be sure to check out the websites, as they will give information on testing centers, demographics, and more useful information. What are the most common symptoms of COVID-19? According to CDC, anyone can have mild to severe symptoms, but older adults and people who have severe underlying medical conditions are at higher risk. Symptoms may appear 2 to 14 days after exposure to the virus, so there is a possibility that you are contracted with COVID-19 but didn't show any symptoms. Symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. If you see someone showing any emergency warning signs, seek emergency medical care immediately. Emergency symptoms include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Keep in mind, though testing supplies are increasing, it may still be difficult to find a place to get tested. There are 2 kinds of tests available for COVID-19, viral tests and antibody tests. A viral test tells you if you have a current infection, and an antibody test tells you if you have a previous infection. To elaborate on the antibody test more, it may not be able to show if you have a current infection because it can take 1 to 2 weeks after infection to make antibodies. Currently, we don't know if having antibodies to the virus can protect someone from getting infected with the virus again or how long that protection might last. For the viral testing results, if you are tested positive, start taking measures to self-quarantine and self-isolate yourself. You should be doing this after you experience symptoms of COVID-19, so this should not be new to you. If you are tested negative, this means you didn't have COVID-19 at the time of testing, but you might still get sick in the future. Who should be tested? CDC recommends using a viral test and does not recommend using antibody testing. Keep in mind that the testing supplies are increasing. It may still be difficult to find a place to get tested. Mild illnesses can be recovered at home without being tested. However, if you experience symptoms, contact your healthcare provider immediately and visit your local health department's website for testing information. Now, how does COVID-19 spread and what can we do to prevent it? COVID-19 can be spread very easily and sustainably between people. It is highly contagious, and since symptoms show after 2 to 14 days, COVID-19 may be spread by people who are not showing symptoms. Ways of spreading include close contact within 6 feet distance, respiratory droplets when an infected person coughs, sneezes, or talks, and touching a surface that has virus. There is currently no vaccine to prevent COVID-19. The virus is thought to spread mainly from person to person. Therefore, the best way to prevent illness is to avoid being exposed to this virus. That means quarantine and social distancing. First and foremost, wash your hands. Couldn't stress this enough, but this is very important. Wash your hands for at least 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your face with unwashed hands. Social distancing is just as important as washing your hands. Be sure to avoid close contact with people who are sick, even inside your home. Stay at least 6 feet, which is about 2 arms length, from other people. Avoid crowded places and mass gatherings. Always remember that some people without symptoms may be able to spread the virus as well. Next up is wearing cloth face coverings. Again, this is because you could spread COVID-19 to others even if you do not feel sick. Everyone should wear a face cover when they are in public settings. Some places like private healthcare facilities and grocery stores require you to wear a face cover. Also, remember, continue to stay 6 feet away from others. Though face coverings are helpful, they do not guarantee protection, and we are still trying to figure out what other ways could COVID-19 spread to others. Remember that you should not wear a face mask meant for a healthcare worker. These include N95 respirators and surgical masks. We want to conserve these resources for healthcare workers who are working at the front lines. You should clean and disinfect frequently touched surfaces daily. These include doorknobs, light switches, handles, your phone, keyboards, faucets, etc. Cleaning with soap and water only reduces the number of germs, dirt, and impurities on the surface, while disinfecting kills germs on surfaces completely. Always follow the manufacturer's instructions when you are cleaning household devices or electronics. Consider putting a wipeable cover on electronics. If there is no guidance, use at least 70% alcohol-based wipes or sprays and dry the surfaces thoroughly after disinfecting. When you are doing the laundry, wear disposable gloves when handling dirty laundry from a person who is sick. Launder items according to the manufacturer's instructions and use the warmest appropriate water setting. Dry items completely. Do not shake dirty laundry. Clean and disinfect clothes hampers before using them. We just talked about cleaning and disinfecting in the previous slides. Remove the gloves and wash your hands right after you do the laundry. Now let's talk more about protective coverings. As local cities and states across the nation begin to loosen our restrictions, it is imperative to stay safe. Most of the time, the virus can travel up to 6 feet, but when lines begin to form in grocery stores and local centers, it can be difficult to maintain 6 feet of distance. Here, the CDC and the WHO recommend to wear a cloth face covering in hospitals and other healthcare settings, workplaces, grocery stores, and pharmacies. They recommend that people older than 2 years of age should wear a mask when difficult to maintain 6 feet of distance, but recommend that people younger than 2 years of age or have trouble breathing should not. When wearing a face covering, it is important to wash hands before putting on the covering. Make sure to not touch the face covering after putting it on. When securing it, make sure it is snug under the chin and covers both the nose and the mouth. There shouldn't be any space between your face covering and your face. There are instructions on how to make sew and no-sew face coverings on the CDC's website. Here's a tutorial of how to make a no-sew face mask by the CDC. The only materials necessary are a bandana and 2 rubber bands or hair ties. What should you do if you got sick? If you are sick, the most important step is to stay home unless you are getting medical care. It is important to avoid public areas in an effort to protect other people in the community, and most people with mild illnesses could often recover at home. When you are staying home, you should also separate yourself from other people in the house by staying in a specific room so as to protect other people in your community. Take care of yourself too. Stay hydrated and get lots of rest. Over-the-counter medicines such as acetaminophen can help. Keep in touch with your doctor and call if you need medical care. Avoid public transportation such as ride-sharing and taxis. This prevents the spread of COVID-19 in the community. If symptoms are worsening, please seek emergency medical care immediately. What could you do as a caregiver if someone in your family is sick? So first, CDC recommends that you should keep a separate bedroom and bathroom for the person, or disposable gloves if you are cleaning their areas, and only clean when needed, for example, like the area is soiled. If you need to share a bathroom in your household, the sick person should clean and disinfect the bathroom themselves after using it. After that, the caregiver or other family member should wait as long as possible before cleaning and disinfecting. Now let's talk about food and trash. The sick person should eat in their separate room as they will open their mouth when eating. Droplets may be spread into the food, which will increase others' chances of getting sick. When you are washing dishes and utensils of a sick person, wear disposable gloves and wash them with soap and hot water, or you can just put them all in a dishwasher. If possible, dedicate a lined trash can for the person who is sick. Use disposable gloves when removing garbage bags and handling and disposing of trash. Wash hands right after. Since quarantine is such a stressful period, let's talk about daily life and coping. Prolonged isolation can cause extreme distress in most people. Fortunately, there are several ways to cope with stress and depressed mood. Quarantined individuals should try to take breaks from the news. Information overload can be extremely worrying for individuals. Taking care of your physical health can also have a positive impact on your mental health. Make sure to meditate, stretch, practice mindfulness, eat healthy foods, exercise regularly, sleep well, and avoid drugs and alcohol. If you are working from home, separate your home and work life as much as you can. Keeping an office space separate from the rest of your home will keep stress at bay. Finally, make sure to keep in touch with friends and family. If you have pre-existing mental health conditions, make sure to monitor new and worsening symptoms. For people who are at higher risk, you need extra precautions. Everyone needs to be precautious when it comes to COVID-19. However, some people need extra precautions. These are people who have serious underlying medical conditions, live in a nursing home or long-term care facility, or are over 65 years old. People who fall under one or more of these categories may be at higher risk for severe illness from COVID-19. These underlying medical conditions include chronic lung disease, serious heart conditions, immunocompromised people, severe obesity, diabetes, chronic kidney disease undergoing dialysis, and liver disease. Adults 65 years old or older are at higher risk of getting severe cases of COVID-19. 8 out of 10 deaths reported in the U.S. have been adults 65 years old or older. That's 80% of COVID-19 deaths. The graph shows the estimated percent of adults with confirmed COVID-19 reported in the U.S. The graph is divided into adults 65 to 84 years old and adults above 85 years old. They are categorized by hospitalizations, admission to intensive care, and deaths. What should you do with your pets and animals? Though it is rare, some coronaviruses can infect animals, which could transmit the virus to humans. This is what is believed to have initially caused the COVID-19 outbreak, the first infection having been linked to a live animal market in China. The first case in the U.S. of an animal testing positive for the virus that causes COVID-19 was a tiger with a respiratory illness at a zoo in NYC. Public health officials believe these large cats became sick after being exposed to a zoo employee who was infected with the virus that causes COVID-19. The investigation is ongoing. There are some precautions that you can take. Keep cats indoors when possible and do not let them roam freely outside. Walk dogs on a leash at least 6 feet away from others. Avoid public places where a large number of people gather. Do not put face coverings on pets. Covering a pet's face could harm them. Do not wipe or bathe your pet with chemical disinfectants, alcohol, hydrogen peroxide, or any other products not approved for animal use. This is because there is no evidence that the virus can spread to people from the skin, fur, or hair of the pets. Talk to your vet if your pet gets sick or if you have any concerns about your pet's health. If you are sick, have another member of the household take care of the pets. Try to avoid any contact with your pet. If this is not possible, then use a cloth face covering and wash your hands before and after interaction with your pet. If your pet is sick, separate your pet from other people and pets in the house. If possible, it is also better to have your pet stay in a designated sick room to further reduce chances of spread. Try to avoid contact with your pet as much as possible and use cloth face coverings and gloves when you are near your infected pet. Note that this is similar to caring for an infected person in your household. Now, what should you do if you go traveling? Travel restrictions vary by country, so it is important to be informed of your country's latest policies. According to CDC, COVID-19 travel recommendations are divided into 3 levels. Level 1 and Level 2 are limited and ongoing community transmission. Level 3 indicates widespread ongoing transmission with or without restrictions on entry to the U.S. As of June the 1st, U.S. is in Level 3 without restrictions of entering the U.S. However, we should know that every single country across the world is currently all in Level 3. COVID-19 is extremely contagious, and you should limit your travel plans to the minimum. CDC recommends to delay all non-essential travel because of the COVID-19 pandemic. COVID-19 cases and deaths have been reported in all 50 states, and the situation is constantly changing. Because travel increases your chances of getting infected and spreading COVID-19, always remember that staying at home is the best way to protect yourself and others from getting sick. Here are some tips in certain circumstances in which you have no choice but to travel. Bring enough of your medicine to last you for the entire trip, in case you get sick. Pack enough hand sanitizer that is at least 60% alcohol and bring it with you everywhere. Always wear a cloth face covering in public places. Prepare food and water for your trip, especially non-perishable food in case restaurants and stores are closed. When you need to travel, consider the following risks for getting or spreading COVID-19, depending on how you travel. Air travel requires spending time at the airports, which can bring you in close contact with other people and frequently touch surfaces. It's also hard to socially distance on airplanes. If you travel by car, taking food or bathroom breaks along the way could increase your chances of getting exposed. Bus or train travel for any length of time can involve sitting or standing within 6 feet of others. If you've just returned home from international travel or a cruise voyage, you should stay at home for 14 days straight. CDC recommends that all people defer travel on cruise ships because the risk of COVID-19 on cruise ships is very high. During this 14-day period, take these steps. First, take your temperature twice a day and watch for any symptoms, especially fever. Use a temperature log if needed. Next, stay at home and avoid any contact with others. Do not go to work or school. Keep your distance from others. Please remember, though lockdown is being lifted in many places, the number of cases are on the rise again. What can you do to help out in this current situation? There are many ways you can help amid the COVID-19 pandemic, even in the era of social distancing. We can still connect with our neighbors and offer support to those in need. Make donations if you can, whether you're supporting PPE drives, donating to local food banks or grocery stores. No matter how much you donate, it will always make a difference. Also, support small businesses during this unorthodox time. Small businesses are in a real struggle right now, and they need your support. Order food by pickups or drive-thrus. Support them as much as you can. Connect with the ones around you. Send letters to healthcare workers and tell them how grateful you are. Regularly FaceTime your friends and family. Fundraise through your passion. Start a fundraising initiative to support COVID-19 relief efforts. Some people are starting tutoring sessions, while others are making handmade crafts to sell. You can also work with local restaurants to distribute hot meals to the homeless during the COVID-19 pandemic. There are many other things you can do to help. It's your job to think of something else to contribute. Remember, for now, staying apart is the best way to be united. As many of their businesses reopen and the lockdown coming to an end, we still need to practice social distancing in order to reach our long-term goals. It's time for us to make a sacrifice while we're still ahead in fighting against the pandemic. Thanks for watching. Hope this video finds you all safe and healthy.